So you're thinking about a career in medical coding. Well, in this video, I'm going to tell you some of the pros and cons of this career so that you can make the best informed decision for you. Today's video is sponsored by Preppy, but more on them in a little bit because in this video, I really want to focus on, is medical coding the right career path for you? Before we dive in, don't forget to subscribe and hit the notification bell because I am going to help you through your entire coding journey and you're going to want to get alerts when I'm posting new episodes. Let's start out with, of course, what is medical coding? Medical coding is a translation type of service. It's not like programming or any kind of computer software learning. It is really the translation, reading medical records, analyzing them, and then converting them into different code sets, drawing out the procedures, the diagnoses, the services that were provided, and converting them into codes. Oftentimes you'll hear billing and coding kind of combined together because billing is a large portion of coding. We want those services to be coded accurately, go out to the insurance and be billed to them and them to get paid correctly. But it's also used for a lot of statistical purposes. For example, if we identify that a lot of patients in a geographic area have developed a certain type of cancer, we want to know when, how severe, what kind of treatments are they getting, and then we can kind of dive into things, or even things like budgeting purposes. If we know that traditionally a pool of 100 diabetic patients are going to cost X amount of dollars, and also of those diabetic patients, this percentage of them are going to develop complications, and that costs this amount of dollars, like we can project and budget how much insurance companies, how much even federal companies like Medicare are going to need to take care of these patients in future years. So it really is a very vital role in healthcare, not only for trending and tracking, but for insurance reimbursement purposes. So let me tell you about the 7 things, though, that you should ask yourself before you decide to get started in a career in medical coding. First and foremost, are you detail-oriented? Because medical coding is a very detail-oriented process. There's a lot of reading through medical records, pulling out little words, and knowing that little tiny things like the words and or could totally change a code selection. Even things like looking at a record and being able to determine, okay, if it said this instead of this, I could convert it to this code, which reimburses higher. Even small mistakes can lead to billing errors, denials, reduced payments. But if you're the type of person that enjoys working with numbers and data and records, this could be a great fit for you. A lot of people kind of equate medical coding to like putting together the pieces of a puzzle. And if that's correct, then it's a large puzzle with lots of different pieces. And it's not even just the reading of medical records. It's reading other exciting documents like insurance coverage policies or even the Federal Register. There's a lot of reading and puzzle solving involved in medical coding. Also, can you work independently? A lot of medical coders are kind of on their own. They do have supervisors that check in on them, but not always on a daily basis. You will have to work oftentimes with minimal supervision, and you have to stay organized, stay on task, stay productive. Now, that doesn't mean that no one's ever checking up on your work. In fact, medical coders are pretty regularly audited. It depends on your organization how often, but they do set productivity standards, so they're going to make sure that you're coding X amount of charts an hour. I mean, that differs a lot depending on your organization, what type of coding you're doing, so I couldn't even tell you like, oh, it's going to be this amount of charts or what have you. It really varies. And accuracy, like we talked about, if you make a small mistake, it could have a big financial impact. So they're going to check your accuracy, they're going to check your productivity, and they'll provide that feedback to you, but it isn't always immediate. It could be from a chart that you coded 3 months ago. So you do have to understand that the feedback in medical coding is not always immediate. Third question is, do you have strong analytical skills? Medical coding involves being able to read and interpret and analyze sometimes some very complicated medical procedures. You'll need solid problem-solving skills in order to make sure that the right codes are assigned. And before we get off onto a tangent about, oh, well, what if AI takes over this job? We've had AI in medical coding for years that assists us because there's such a level of complexity. There is such a volume of healthcare services, right, that we need some assistance in order to help us guide us to the right code. This is not just a simple look up, oh, this is this. Sometimes there are smaller procedures that have codes assigned to them, but they're included into larger procedures that have codes assigned to them. It's knowing what diagnoses are included in other diagnoses. For example, if a patient has a severe upper respiratory infection, well, we're not also going to code that they have a cough because that's part of having a respiratory infection. Plus, there's sequencing guidelines. Codes can change depending on what insurance the patient has, and there's a lot of different factors, even things like location of where the patient was seen. So you even need to know as a coder, like, what do I do when that piece of the puzzle is missing? Or what you need to do when the verbiage in the documentation doesn't match up to the code and you're like, hey, I know this was the procedure that was done, but that's not what this says. Or even how to effectively communicate that with someone like a doctor or a nurse practitioner. The fourth question is, are you comfortable with technology? As a medical coder, you'll be using all kind of software like electronic medical health records on a daily basis. So it's essential to have some comfort level with tech so that you'll be confident when you're doing things like reading through a record and determining which person documented certain parts in the medical record, because there are regulations saying that only certain types of providers can document in the medical record if they're also going to bill for that service. Even software programs like Outlook, Excel, and Word are crucial to medical coders because you might have to draft an email to a doctor to ask them some questions about a medical record that they wrote. You might have to work in an Excel spreadsheet to document discrepancies that you're seeing or work on a special billing project. And if you want to progress in your career to things like compliance or auditing, there's going to be more software you're going to have to learn, like the different auditing software that's available. Question 5, are you willing to invest in training and certification? Because medical services are expensive and stakes are high, a lot of employers want their medical coders to have gone through formal training and have passed a certification exam through AAPC or AHIMA. This may mean investing some time and some money, so that's definitely something you want to think about before making a commitment to this career. I actually have a whole video that breaks down a lot of the costs associated with being a medical coder, including things like your books, certifications, membership dues, etc. I'll also link it below and at the end of this video, so if you want to go and check that out, you can. Now, if you want to get trained in medical coding and you want a program that is top-notch but affordable, then you definitely want to sign up for my free masterclass at medicalcodingmasterclass.com. The Career Masterclass is free to sign up. It doesn't teach you medical coding. It teaches you about the career of medical coding and gives you that whole checklist of, like, if you want to be successful in this career, you need to do this, you need to do this, you need to get this certification, you need to understand this is the salary and about how long training takes. And then it will tell you also about the program that's going to check off all of those boxes. And it's the one I recommend. It's called Preppy. It really is the best program out there. Again, I will link it in the description below, medicalcodingmasterclass.com. So after you're done with this video, you can check that out if you want as well. Now, question number 5 you're going to want to ask yourself is, do you enjoy a structured work environment? Medical coding is fairly structured. You have a certain specialty usually that you work in, or a certain type of coding you do. You might have a work queue that's just filled with all of the different cases you need to code, and it's structured. You know that you're supposed to code X amount of charts of an hour and at a certain accuracy rate, and you just boom, 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 go down them. You have to adhere to strict guidelines and policies, things like the federal government put in place to make sure that you're secure, that you're not going to put your organization at risk of an audit. Also, some of those rules like the insurance policies change pretty frequently just to keep you on your toes. So if you kind of thrive in that structured setting and you're good at following the regulations, but also like things to change periodically just so that you can question your own sanity from time to time, this may be a great career for you. Last but not least, you really should ask yourself if you are interested in the healthcare industry. While medical coders aren't hands-on with patients, you do play an important part in the healthcare system. So a genuine interest in medicine will help you stay active and engaged in this career. And you may find that you have to work with others in the healthcare industry, things like doctors, nurse practitioners, practice managers, even maybe some people in registration or billing. Depending on your role, you could even be talking to like team leads in different departments or just lots of other people in the revenue cycle. And as this complexity in medical coding grows, it's going to be more important to understand things like disease process or what is involved in a medical procedure. Again, this isn't really an like easy peasy lookup like you would look up a phone number in the phone book, probably dating myself a little bit there. It's not something that you can learn just in a couple of days and start working from home while your toddlers are running around. It really requires a lot of attention, dedication, and continual learning, and meeting those productivity and accuracy standards. So deciding whether medical coding is right for you really does involve some soul searching of what are your skills, what are your career goals, what are your interests. It really is important to research this thoroughly and identify your own personal strengths and weaknesses. Medical coding is a really great career. It offers a lot of flexibility. There's a lot of work from home opportunities. There's tons of room for growth and career advancement and additional certifications. However, it does require a high attention to detail, and it requires you to work independently and to be willing to adapt to all those changes. So if you're ready to learn more about this career, like what to expect in a typical day, salary expectations, head over to medicalcodingmasterclass.com. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.